Let's talk about what Medicare is. For the next few episodes, we will discuss the different parts and what they cover. When you first enroll in Medicare, you're enrolling in what's called Original Medicare, which is made up of two-part, Part A and Part B. Part A is your hospital coverage. It helps pay for things like inpatient hospital stays, skilled nursing care following a qualifying hospital stay, hospice care, and some home health services. Most people don't pay a monthly premium for Part A because they paid Medicare taxes while working. Part B is your medical coverage. This is the part that helps pay for doctor visits, specialist lab work, outpatient procedures, preventive services, and medical equipment like walkers and diabetic supplies. Now here's where many people are surprised. Medicare is not completely free. Most people pay a monthly premium for Part B, and if your income is above certain levels, you may pay even more through something called IRMA, which we'll cover in a future episode. Another surprise is that Original Medicare doesn't cover everything. It generally doesn't cover routine dental care, vision exams, hearing aids, most prescription drugs, or long-term custodial care. And perhaps the biggest gap is that Medicare doesn't have a built-in annual out-of-pocket maximum. For most Part B services, Medicare typically pays 80% of the approved amount, and you're responsible for the remaining 20%. That's why many people choose to add either a Medicare supplement and a Part D drug plan or enroll in a Medicare Advantage plan. The important thing to remember is that Original Medicare is the foundation. Before you can decide which additional coverage makes sense for you, you need to understand exactly what Parts A and B do and what they don't do. In our next episode, we'll talk about Medicare Part D prescription drug coverage and why it can be important even if you're not taking any medications today. I'm Donna with Savvy 65. Be sure to and follow so you see every episode in our Roadmap to Turning 65 series.